Okay, let's just jump right in. Artificial intelligence, it's not some sci-fi movie thing anymore. It's here, and it's already changing the world of medicine in some pretty incredible ways. So today, we're going to look at 3 real-world examples of how AI is already tackling some of healthcare's biggest, toughest challenges.
So, that really brings us to the big question, right? Can this tech actually solve the massive challenges our doctors and nurses face every single day? I'm talking about things like spotting diseases earlier, creating personalized treatments, and even tackling human error. Let's dig in and see. And look, right off the bat, let's get one thing crystal clear. The goal here is not to replace doctors, not even close. The theme you're going to see over and over is that AI is this powerful tool. Think of it like a co-pilot or a digital assistant that basically gives our amazing medical experts superpowers. It's about augmenting their skills, not replacing them. All right, so for our first story, we're jumping into one of the most critical races in all of medicine, the race against the clock to find cancer as early as humanly possible when it's at its most treatable. I mean, for millions of people, getting a mammogram is just filled with anxiety, right? And for good reason. It's such a high-stakes moment. You've got these incredible radiologists staring at scans, searching for these tiny, subtle signs that are incredibly hard to spot. The pressure to get that call right, it's just immense. And here's a perfect example of just how complex this is. We're talking about something called breast arterial calcifications, or BACs. Basically, they're these tiny little calcium deposits. Now, most of the time, they're totally harmless, but they're just one of these thousands of tiny details that a radiologist has to analyze with perfect precision on every single scan. So, where does AI come in? Well, enter Curometrics, and this is a huge deal, okay? Because this was the first company to ever get FDA clearance for an AI tool made specifically for mammograms. That's not just a small step, it's a massive signal that the whole world of diagnostics is starting to change.
And what's so important here is how it works. See, the AI doesn't make the final call. That's still the doctor's job. What it does is analyze that image with insane precision, and it flags any little area of concern for the radiologist to take a closer look at. It's basically the ultimate second set of eyes, doing the heavy lifting and making sure absolutely nothing gets missed.
Okay, so let's move on to our second story, because this is where things get even more interesting. Spotting the cancer is one piece of the puzzle, but what's next? Figuring out the best way to treat it for each individual person, well, that's a whole other gigantic challenge.
So here, we're looking at a really aggressive form of kidney cancer. Now, modern medicine has these amazing targeted therapies, but here's the problem. It's often a guessing game to figure out which one will work for which patient. And when you're fighting a disease like this, time is the one thing you absolutely do not have.
Okay, now get ready for this number, because this is a total game changer. Researchers built an AI model that can predict survival outcomes for these patients with, get this, 93.66% accuracy. This isn't just some lab experiment. That kind of accuracy, that kind of foresight, it can totally change how a doctor approaches a patient's treatment, right from the very first day.
So you're probably asking, how on earth does it do that? Well, the AI basically swallows this massive amount of data. We're talking CT scans, all the tumor's characteristics, and it finds these hidden patterns that a human eye just might not catch. Then, it classifies the patient into a specific risk group, which helps guide the doctor straight to the therapy that's most likely to work. It's personalizing medicine on a whole new level. And the experts who built this, they don't pull any punches. They literally call it a transformative advance. And that's what this is all about, right? Moving away from that one-size-fits-all approach and getting to truly personalized care. It gives patients a much better shot and saves them from going through treatments that were never going to work in the first place. All right, for our third and final example, we're going to shift gears a little bit. We've talked about diagnosis and treatment, but now let's talk about one of the most persistent dangers inside any hospital: simple, preventable human error. Look, even the absolute best doctors and nurses are still human. And when you're in a super high-stress, chaotic place like an operating room, mistakes with medication can happen. A simple mix-up, swapping one little vial for another, can have absolutely devastating consequences. It's a huge cause of preventable harm in hospitals today. So, what if you could have a safety net with this level of accuracy? Check this out. A new AI-powered wearable camera showed 99.6% sensitivity in catching these vial swap errors before they happen. I mean, just let that sink in for a second. That is almost perfect. It's like having a guardian angel for patient safety, working in real time, right there in the room. And the way it works is actually beautiful in its simplicity. The doctor or nurse wears this small camera on their head. As they're getting a medication ready, the AI is watching. It's scanning the labels on the vials and the syringe in real time. And if it sees a mismatch, bam, an alarm goes off, either visual or with a sound, and it stops that error dead in its tracks before it can ever harm a patient.
So the implications here are just massive. You get this huge extra layer of safety. You cut down on paperwork. It all connects to the hospital's records. But honestly, the most important part might be that last point. 88% of the doctors they asked said they would be willing to use it. Because you can have the greatest tech in the world, but if the people on the front lines don't want to use it, it's worthless. This thing has their buy-in. So, okay, we've seen 3 incredibly powerful examples of AI in medicine today. So the question is, what's next? Where is all of this heading? Let's take a look at the road ahead.
Okay, so think about it like this. Right now, AI is kind of like a specialist. It's this brilliant algorithm that's amazing at one specific job, whether that's reading a scan or checking a drug label. But the vision for tomorrow, it's so much bigger. The idea is to take that same intelligence and put it inside a physical body, like a humanoid robot that could help with all sorts of patient care.
And just so you know, this is not science fiction. The biggest names in tech, I'm talking NVIDIA, Google, OpenAI, they are pouring millions, probably billions of dollars into this as we speak. They are literally building the next generation of robotic hospital assistants right now.
And that leaves us with one final, kind of mind-blowing thought. I know it might sound a little out there today, but with how fast this tech is moving, you really have to ask the question, are we going to see a day where these humanoid robots are in every single hospital room, just as common as the smartphone you have in your pocket? It's a wild thought, and I guess only time will tell.